Welcome to EAU podcast series, Exploring Urology, a Roadmap for Medical Students. In this third episode, Urology as a Career Choice, we are joined by Assistant Professor Giancarlo Marra and Dr. Rossella Nicoletti. The speakers address common misconceptions about the specialty, explore diverse career paths, and share practical advice on training with insights into the rewards and challenges of urology. This episode aims to inspire and guide medical students as they consider their future in this exciting field. Whether you're considering urology as a career or are simply curious, join us as we uncover why urology is an essential part of modern healthcare and an exciting career path.
So, ladies and gentlemen, dear colleagues, it is a pleasure to be here today for this podcast session. My name is Giancarlo Marra and I'm an assistant professor at the University of Turin in Italy. And with me today, it is my pleasure to introduce Dr. Rossella Nicoletti, who's almost a urologist because she's finishing her residency in Florence at Careggi Hospital in Italy. Welcome, Rossella. It is a pleasure to be with you today.
Hi, Giancarlo. Thank you for the kind introduction. And I'm very happy to be here with you discussing with this interesting topic. I hope it will be helpful to some of our young friends and hopefully it will make their choice easy.
We wish after listening to us, they will choose urology instead of choosing another specialty.
Hopefully, we have to solve them.
Let's see what we can do. So today we are going to discuss urology as a career choice. I think we could start, let's say, saying why we chose the urology, we chose this career path. So, Rossella, why did you end up doing urology? What made you start this path?
So actually, it was quite random choice at the beginning because I was likely involved in an internship during my med school in urology department. And I didn't even never thought about this career before. But then I realized during my days into the department, it was quite interesting because I saw so many technologies and big surgeries using a lot of robotic surgery. And also, I felt like a challenge to be a female in this department because when I was there, there were no female residents in the department I stayed in. So I felt this as a challenge. This was my first impression at the beginning. And then I decided to stay in this department for some weeks. And then it becomes months. And eventually it becomes my choice of the residency. So what about you, Giancarlo?
So for me, it was quite similar, meaning I didn't start med school or I didn't want to be a urologist 20 years ago. It came out randomly. So the fourth year, I don't know where you studied, but in Turin, because I did my university in Turin as well, we started going in the internship in the different wards at the beginning of the fourth year. And my first ward I had to go to was urology. So it was funny, a few days ago, on Facebook, it came out a post I posted one day before starting in which I was complaining I was going to do urology because of DRE and because all those things. And then actually I liked it. So I spent 1 month and a half in urology, and then I chose it again and again. Then I did my Erasmus in France in the fifth year, and there was the department where actually was working Nicolas Motet, which until a few months ago was the chair of the prostate cancer EU guidelines. It was a very dynamic department with very nice people, and there I started to the first part of surgeries. Not something big, of course, but it motivated me a lot. And then when I came back to Italy, I decided to ask the thesis in urology, and then that was it. But it was quite fun because at the beginning I was complaining about having to do 1 month and a half in urology, and then it ended up being my career.
So the rest is history, right?
Exactly. We can say that at the moment.
So now you're a professor in urology. So how strange is life, right?
Exactly. That came out a few weeks ago and was quite fun for me. Sometimes you don't expect it, but then, life is like that for urology as for many other things. But for us, it was urology. So now you are almost done with the residency. If you would have to say what are the pros and cons of your residency, how was your residence in terms of timings and in terms of work-life balance in general?
I think the words that can summarize my residency will be challenging, but also rewarding. This because I think in terms of cons, the urology residency is burdened by a high psychological burden, I think, because you have to manage so many different cases, and sometimes you can see very hard cases to be followed in terms of like cancer or trauma and things like that. But also because there is a fragile life work balance, because probably everyone knows the surgery residency is quite hard. You have to work a lot and you have to show yourself a lot inside a hospital in order to learn the surgery and everything. And I also can tell that the competition is quite high inside the urology residency. So I will say, first of all, that urology residency is challenging, but also it's quite rewarding because first of all you can keep in touch with a lot of technology and innovation, because we work a lot with so many engineers working with artificial intelligence, robotics and lasers. So we have a lot going on, especially in the university hospital. And also you have so many academic opportunities. We both works a lot with academic, and we can tell that it's a high rewarding work. You have to work a lot, but in the same time, you have the chance to keep in touch with so many people from all around the world, and also to attend the congresses. I will just mention my favorite congress recently. It was the AREP, that was quite fun. And also you can have a lot of hands-on training during your residency. I will just tell my experience as a resident in Italy, but I can tell that probably around Europe, you can have a lot of opportunity in surgery. So challenging and rewarding are my two words for urology residency as a younger and almost a urology, because I'm actually in the last week of residency. But I would love to hear your point of view, because you're more experienced, and probably you had the opportunity to work a lot with so many generations, not so many, but some generations of residents, right?
Yeah, so for me it's a bit more far away, but still not that far away, luckily. If I have to remember and to try to describe and summarize my residence in a few words, I think it would be the most important fact for me is that I used to work a lot. So now when I tell my residents I was working more than they are doing, sometimes they are complaining about that. I'm not saying it was good to work more than they're doing, but when you spend a lot of time at the hospital, then you end up being a family. So for me, it was not really, it was challenging in terms of timings because you had to spend a lot of time in the hospital. But no, in terms of competition, the competition was within a family. We were four in my year. Now there are much more residents that are coming in. So we had to do lots of things, starting from from surgeries to the ward and everything. And we were supporting us a lot. So at the end of the day, we were then having dinner together or going out together. And actually, the other three residents I did the residence with. One is one of my colleagues, so he's working with me. And with the other two, we still remain really, really close friends. So I think it's challenging. You spend a lot of time, but you also meet a lot of interesting people. Some of your residency will stay with you all your life. And of course, it's about work, it's about learning, but when you start a surgical specialty, then I think the friendship you can build are very important and are very strong, because you share a lot of beds, but also good moments together. I think this is a good point.
I completely agree on your point. Also, because I think one of the most important tip and tricks that I can tell to the listener is to find a buddy during the residency. You always have to find a person that you really trust in your work, and you have to also get a friendship with them, because you will need a lot of help during the journey. So from starting from them, I would like also to ask you, what about the fellows? Like, do you have any suggestion? Because you mentioned previously that you did some kind of internship in France. So how would you recommend to the youngers to choose the place where to go for a fellow or for an Erasmus program during the residency or during the med school, perhaps in case you're not sure you want to be a urologist? Do you have any suggestion?
Yeah, I think you made a great point. Meaning, this is also another thing I try to convince my residents, because sometimes, especially now, it's changing because the majority of residents are not coming from the same city in Italy. This was already like that since many years in France and Spain, where they're moving around as we are doing now in Italy. But a lot of people were choosing the same city, so staying in the same place, and were not very keen of going out of their comfort zone, so doing a period abroad. And I think this is very, very important. It's very important from a professional perspective, but even more important from the personal perspective, because you stay 1 year outside of your country, you stay in a new city. Hopefully, if you choose it, it's going to be a city you like. You won't end up in a place you don't like. And I think it's key to do such experience, because it puts you in contact with people doing your same job but in another country, and you actually learn a lot, and a lot. And if I would have to stick this to urology, another good point is that a specialty in general, we are quite easygoing. This doesn't mean we don't work. We work a lot. But within Europe and also outside Europe, it's not difficult to find a place that will host you, in which you'll be able to learn surgery, but also to learn how to do academic. So for me, it was a bit particular, because I spent 2 years during my medical school outside, one in France and one in the UK, in London, because I did my medical thesis in London. And then I spent the last year of residency and the first year as a consultant in Paris, in France, and both have been amazing experience. I think it should become a must. You actually haven't done, I think, a fellowship within Europe. You went even more out of your comfort zone, actually, because you spent a period abroad in Hong Kong. How was your experience? How is urology in Hong Kong?
Actually, I cannot stress enough, when you have to choose the fellow alongside your research and learning objective, I think you should also focus in the country you have to go, because it's very important that you feel comfortable and also you feel safe in the place where you're going. So my choice come from the fact that during med school, I spent 1 month in Indonesia at Surabaya in a hospital for a fellow. So I've basically fallen in love with Asia, and I kind of promised to myself to come back in Asia for another period of my life. So when some of my older colleagues suggest me, like you're doing, to do a fellowship, also to reach my goals in terms of research and surgery, I decided to go to Asia. And then I chose Hong Kong because it's a magical place in terms of research, in terms of surgery, and most importantly, they speak English very well. So it's a kind of British speaking countries. So it was quite easy for me to get in touch with the hospital and with all the resources of the hospital, like the wrappers of the OT, etc. It was very good, and it was a good experience, not only in terms of urology, but as a lifelong experience. So my suggestion would be not only to choose the country in terms of opportunities for your career. Of course, this is very important, because otherwise it's like you're failing the goals of your fellow. But I think most importantly, you have to choose a country that gave you the opportunity to grow as a person. And in my experience, Hong Kong was the right choice for that. So hopefully there will be other European people going there, and in Asia in general, because Asia is actually a quite interesting and growing place of the world. So I think it will become leader in so many technologies, actually.
We are growing. We are growing a lot, and certainly, to conclude the fellowship part, I think at the moment I didn't see even one resident coming back from a fellowship and being sad about the fellowship. Sometimes someone can be sad about some aspects. Maybe sometimes the expectation not fulfill 100%. I think this is a strong recommendation. For us, it's easy because we have both done the fellowship, but it's very important. And as a mentor, I try to push people to go abroad all the time. And actually, it's happening. We are doing it. I think the new generation is more keen to do it compared to in which I was doing the residency.
I completely agree with you. Actually, the perfect fellow does not exist. So, of course, I can tell you that there were so many challenges during my year in Asia. Of course, the culture was so different and it was not easy to be integrated into the groups of people there because they had so many aspects of their life that were quite different for ours. But overall, as you said, I never heard someone complaining about some months abroad, not only because of the career choice, but also as a life choice in general. So I completely agree with you. So next question for you will be, which are, in your opinion, the challenge of this choice as urologists? So which are the challenge for a young med students to embrace this career choice?
As we said, I think when we were mentioning and we were discussing about the residency, so especially at the beginning, because you have to learn a lot, so you need a lot of dedication. This is challenging because sometimes it's not like an exam in medical school in which sometimes you study 70%, you get the good question, and the exam is passed. It's not the same thing, it's completely different. So you need dedication. You need to spend your time. You need to learn things because you are on the field. You are dealing with people. You're dealing with patients, and the outcome depends on what you're doing. And there is a lot to learn. I think we will learn during all our urological life. Actually, learning never ends. But this is also the good thing. I think you don't have to be scared at the beginning. You have just to work. And you have to imagine that the more you work at the beginning, the more you will be confident after a while. When I started residency, it was not possible and no one was able to imagine leaving residency. Now there are people that sometimes are leaving it during the first year or second year because of a workload. If someone starts a urological career, you don't have to think on the short term. You have to think a bit wider, a bit on the long term, a bit towards the end of the residency, in which you will be your own guide in terms of timings, in terms of how much you want to spend. But at the beginning, this is a challenge. You have to work a lot. After a while, you will get the reward. In my opinion, this is the most important challenge to face. What about you? What do you think is the most challenging thing about starting urological residency, about choosing urology?
Actually, you raised a very good point about the life balance and about the fact that actually new generation are more concerned than us on mental health and psychological balance of your career. So I completely understand the fact that new generation may prioritize their psychological health and well-being. So in case they understand that this is too stressful, they may realize that this is not their career choice. As my personal experience, I went through this kind of pivotal point during my second year of residency. I was not sure to conclude my residency in urology actually because of the work-life balance was very hard for me. And I had ending like going to therapy for this reason. And actually the therapy helped me a lot on balancing the stress. So in this case, my suggestion will be to try to find help and ask for help because it is challenging, it is competitive, but you may find your balance in case you think that may be the career of your life. And the second challenge, of course, again, I will mention the fact that as a female may be sometimes a little bit more challenging because right now the things actually are changing. And I know that EAU is doing a lot on that. They have also some groups that are trying to address this topic. But I can understand that females med students may feel underrepresented in urology, but I can feel that the things are changing slowly, but they are changing. So I would like to send a positive message on that. So we are trying to build a network of female urologists. So in case you may feel the fear of embracing this career because of your sex, don't feel ashamed and feel free to contact me or other female urologists. We will be more than happy to build a network and also to help you rise your choice. That's a challenge, but there are so many solutions and we are trying to address this problem. And I know that so many people like you, Giancarlo, but so many other male urologists are helping us to let us feel safe in this environment.
I think this is a crucial point. Of course, I couldn't say it was a challenge for me because in my residency, like 5% we were male. Now things are changing. I think there are more female than male amongst the first years of residency, and I think it's very important. And it's very important to have a balance because, of course, women have a different way of working compared to men, and it's very important because this helps to have balance and improves the quality of work. Because, of course, you care about a lot of different aspects that, for example, for us are not there. And I think it's crucial to have this kind of balance. We are reaching it. We are working towards it. I think you are a great example of this ongoing change. To move on, so we discussed about the challenge, we discussed about the residency, first part, why to choose urology, what's going on during the residency. So very difficult, very challenging, you have to work a lot. So you are almost there. I'm there since a few years. The time to get the reward. So what are you expecting now that you're going to finish residency? How will your life change? Are you seeing any benefit? Are you expecting any benefits now that residency is almost over?
Well, actually, as you can imagine, I think you experience similar emotions when you finish your residency. I'm actually a little bit scared of what will happen next week because I will finish my residency next week. And I'm a little bit scared, like I'm not sure what it will happen. I have some ideas. Of course, I understand I will have some responsibilities because I will continue working on the place where I did my residency as a PhD student. So I will pursue an academic career, hopefully, and I will continue doing research. But I feel the fear of the responsibility of becoming a model for the younger residents that will start their residency next week. When I will finish, I will become their reference for surgery, for research, and also for clinical attachment and outpatient clinics. So first of all, responsibility, but also excitement, because I hopefully will be the younger consultant I wish I met during my first residency. And this is my goal, actually, to become the helper and the supporter and hopefully the mentor for the younger generation that are coming in Florence next week. It's very hard, I think. And I know, of course, there will be some mistakes during my path, but this is my aim at the beginning. And secondly, I'm actually very happy because it's like the closure of a period of my life that was very important. But it's a privilege to grow, and we should be very grateful for the fact that we finish our path of 5 years, and now is opening a new chapter of our life. Probably I'm doing too much philosophical, but I can like sum up with I'm scared, but it will happen anyway. So let's see what happened. That's like to summarize, but probably you can tell me a little bit better in what will happen like the first weeks or months after the finish of the residency. You can tell me better. You already experienced that very recently.
Yes, so for me the change was quite quick. The day after I finished residency, I was already working as a consultant in France, so I didn't take a week off. But I think it's important, as we said before, to not to look too much on the short term, but to look a bit on the longer term. So without being personal at the beginning in discussing what happened to me, I think urology is a good choice, especially when you finish the residency, because if you have worked well, if you know what you have done, if you end up the residency by being a good urologist, of course you cannot get the experience of someone that has 20 years more than you, but there is a moment where you can make a lot of choices. So you can choose to keep on and try to do big surgeries, to do a lot of OR, and to spend all the day in the OR. You can also choose not to do OR anymore and to do just clinic. Or you can choose to do a bit of clinics, a bit of big surgeries, and a bit of endoscopy. You can do a lot of things, actually. And I think this is one of the best things of urology. Again, I did not choose the urology thinking about that, but I think that now with the new generation thinking a lot more about work-life balance, urology is a good choice. If you complain about being too much in the OR, you can do less OR. If you want to be all the time in the OR, you can do more OR. This just depends on you, on your motivation. You can actually do this choice. And you can do this choice in Italy, but it's going to be the same in France, where I worked 2 years and a half. It's going to be the same in the UK. It's going to be the same in Spain, which are countries in which either I've worked, either I know quite well some good friends. So if you choose urology just because of that, at the beginning, I think it's going to be too hard. You need to like it a little bit as well to go through the first years of residency, but then it allows you to space a lot, to set your work-life balance where you want. I also chose an academic path, so this means I think a bit more work compared to a non-academic path because you have less free time. You actually end up to do the same working shifts that you can get in a normal hospital, plus your free time for research, or a big part of your free time. Also, working in a university hospital, I think one of the most rewarding things is after 1 year, you see people growing, you're able to discuss with them, and it is good for you, and I think it's also good for the others. So this is a very positive thing. It's not only about urology, it's about every specialty. It's good to work with younger generation and to try to guide them. To conclude, I think a good thing, especially when you start residency, but during all your career, if I would have to say a tip, do not only see people that you like as an example, because earlier you said I have some example of urology I would like to be, but also in my mind there are also the bad examples, the people I don't want to be. So sometimes it will happen that you will not agree with someone, you will not like the way someone work. Well, I think this is also something you have to keep in your mind, saying, I don't want to be like that. I don't want to repeat this thing. Sometimes you will actually end up close to that. But then if you will remember it, you will stop doing it and you will move on. So keep in your mind a good example, but also bad example. I don't know if you have any other tips about this.
My biggest tips is first, try to learn something from everyone. Everyone has something to teach you in bad and in good things. And second is transform competition in collaboration. So whatever you see someone that you feel like it's very good, don't try to compete, try to collaborate, because you don't want to be the smartest guy in the room. And the third thing I think is find your buddy in urology. You really need one. And I have so many experience, my big friends. I have a super big buddy in my urology residency. And during the first, the second, and the third year, we spent so many times. I called her and asked for the help. And you really definitely need someone that helps you. So try not to be alone in this path, because it's not super easy. So you want some friend. That's all basically my tricks. It's all about networking and having people that cover your shoulders.
Find a family is a very important thing, because then you will have complications, and when you have a complication, it's very important to have people to talk with, to discuss with, to find a solution, because if you find a solution in three people, it's better to find it alone. So I think we're almost towards the end. We can leave now at the $1 million question. Would you do it again?
So that's really the $1 million question. For me, it's a yes. The answer is yes, I will do it again. Probably I will try to stress a little bit less, because in the end, the most important thing is to be happy in life, and the career is just part of your life. Of course, it's very important. We both know that, because otherwise we won't be here discussing about that. I will say, yes, I will do it again. And it's a very, very brilliant choice. And as you said, again, you can have a lot of opportunities. And in case you feel alone, try to find people that will help you in all the possible ways. And what about you? Will you choose it again?
Yes, 100%. I would say 100%. For me, very easy question. As you said, I think an important thing to keep in mind is that it's about your life. Your life is not going to be just about work. If I would be back, perhaps I would try to be a bit more relaxed in certain way. Not to work less, but maybe in a more relaxed way, as I think new generation are doing.
I think we should learn a lot from younger generation from this topic. They know way more than us on this. So probably my last comment is, let's try to learn from youngers. Probably is better.
Exactly. It was, I think, a very nice discussion. I learned a lot in general about your perspective on urology and about you. Thank you very much for your time. We hope by listening to this podcast, some will pick urology as a career choice.
Thank you very much, Giancarlo. It was really a pleasure for me to share this moment. I'm honored to be here with you. And as you said, I hope this will help someone driving their decision in their urology career. And hopefully we will be contacted from so many medical students to try to help them. It will be my pleasure to help some other young colleagues embracing this choice.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.